What are the 7 steps of effective wound management? Why is each step important? And what happens during each one? Knowing the answers will help you develop and support the most effective treatment plan to promote healing. Let's take a closer look at the role of each step and how it's typically performed by a clinician, such as a certified wound care nurse. Wound assessment is the first and foundation step of proper wound management. The goal is to identify and address all issues that may impact and potentially delay healing. This will help guide the development of the most effective treatment plan, in keeping with the healthcare provider's established wound care guidelines. To perform this step, inspect and evaluate the wound based on several characteristics. Start by identifying the location, length, width, and depth of the wound. Then check for undermining, which is a rolled over lip around the wound. Also check for tunneling, which occurs when the wound burrows under the skin. Next, look at the exudate for drainage color, odor, amount, and consistency. And examine the tissue appearance for color and moisture level. Is it wet or dry? Another important characteristic is the peri-wound, which is the area surrounding the wound itself. Is the peri-wound intact or macerated, which means shriveled skin caused by prolonged moisture? Then, examine the wound for infection and bioburden, which is the state between normal and infected tissue. Is the wound red, a condition called erythema? Is there swelling, known as edema? Is the wound warm? Does it have an odor, or does the patient have a fever? Lastly, what is the patient's level of pain? By assessing all of these wound characteristics, you'll be in a better position to develop and implement the most effective treatment plan and move on to the next step, cleansing the wound. Cleanse and irrigate the wound per its assessment. Cleansing and irrigating the wound creates the optimum environment for healing in 2 ways. First, it removes loose debris, exudate, pus, and free-floating bacteria. And second, it supports the wound assessment by making the wound easier to see and evaluate. To cleanse the wound, swab it with dampened gauze or a similar product and irrigate to remove deeper debris. Step 3 is to protect the peri-wound from wound drainage that can cause maceration and skin stripping. Protecting the peri-wound skin is also essential because it helps prevent the wound from increasing in size. But this can be a challenge because peri-wound skin can appear normal. As a result, protecting it can be overlooked and damage can occur. To protect the peri-wound, clean it with a normal saline solution, then apply a non-alcohol-based skin prep solution. Next, fill any depth in the wound by packing all open spaces with the appropriate filling material. This step is important because it helps prevent pockets of abscess from forming, as well as promotes healing. Wounds that require filling include tunneling wounds, undermined wounds, and stage 3 and 4 pressure injuries. Fill them based on the wound assessment, the wound's contours, and the clinician's discretion. Choose from gauze, foams, fibers, alginates, and gels. For infected wounds, add an antimicrobial agent. After filling the wound, apply a protective dressing to cover the wound. The goal is to maintain a clean, moist wound bed, which promotes granulation, healing, and closure. Properly covering the wound also helps prevent infection while the wound is healing, and until healthy skin can resume its infection-preventing role. If the protective dressing doesn't secure itself, apply a secondary dressing. This step helps promote healing by protecting the wound from pathogens. Securing the dressing also secures medical devices and aids in patient mobility. Select the most effective secondary dressing based on provider policy and procedures. Examples include gauze, conforming stretch bandages, tape, transparent film, and composite dressing. These products attach to, cover, or pad the protective dressing and help ensure it stays in place. The final step is to evaluate the wound's healing progress when you change dressings. Is it healing, regressing, or is there no change? Knowing this is important because it can help you determine if the treatment plan is succeeding or if another approach is required as soon as possible to promote healing. To evaluate the wound, ask yourself, are there any new signs of infection, such as a change in color or odor? Are the protective and secondary dressings staying in place? And if applicable, is the drainage control working? To help promote healing, know the 7 steps of effective wound management. Assess, cleanse, protect, fill, cover, secure, and evaluate. To learn more, visit cardinalhealth.com.